Hello, my name is Lindsey, and I conducted my doctoral capstone experience to promote the utilization of occupational therapy services for delirium management in the intensive care unit. First, a systematic review of the available evidence was conducted. The research question was, what occupational therapy interventions are the most effective for decreasing delirium in adults admitted to the intensive care unit? The aim of the systematic review was to determine the effectiveness of occupational therapy intervention to manage delirium in patients admitted to the intensive and critical care units. This review was completed according to the PRISMA method. 4 databases were searched using 2 search strings to gather all relevant literature. To be included in the review, studies had to be published in English from 2009 to 2020, include occupational therapy, interventions that occurred in the intensive care unit, and utilize delirium as an outcome. Studies were screened and 4 were found to meet all inclusion criteria. Data was extracted, risk of bias was identified, and methodological quality was assessed by 1 reviewer. As you can see, the PRISMA diagram outlines the process of study selection. The results of the systematic review included 4 articles, 2 prospective cohort studies, and 2 randomized control trials. The randomized control trials had low levels of bias, whereas the prospective cohort studies had moderate risk of bias. All studies found decreased delirium severity, incidence, and duration with occupational therapy intervention. The grade process to determine methodological quality identified occupational therapy management of delirium to have a weak recommendation for the intervention. Even though the quality of evidence is very low, few to no adverse events occurred. In conclusion, occupational therapy intervention should be utilized to manage delirium. Intervention must include aspects of early mobility, sensory stimulation, positioning, upper extremity preservation, participation in ADLs, and family and caregiver engagement. My capstone experience occurred at Ohio Health Grant Medical Center in downtown Columbus, Ohio. This site is a level 1 trauma center with an intensive care unit and critical care unit. Throughout the experience, a variety of both clinical and administrative opportunities were available. 1 day each week was spent in the critical care unit observing OT treatment evaluations. I was responsible for the care of 2 to 3 patients each week, which included performing evaluations and treatment, as well as documenting sessions, writing plans of care, and creating appropriate goals. The patients had various diagnoses ranging from traumatic brain injury to cardiopulmonary conditions. The CAM ICU delirium screening tool was administered to various patients with differing levels of function to determine their current delirium status. I had the opportunity to represent the rehabilitation perspective during delirium rounds with the interdisciplinary team. Other clinical experiences included observation of additional Ohio Health care sites, collaboration with the interdisciplinary team to coordinate care, and providing education to family members on delirium. The remainder of my capstone experience focused on administrative projects. An evidence-based flow diagram for occupational therapy management of delirium in critical care and associate training was created. A smart phrase was created in the EPIC documentation system to aid ease and consistency of documentation of delirium management interventions. A survey was administered to the interdisciplinary team to determine baseline delirium knowledge. Various literature searches were performed to examine the literature on delirium screening tools, determine effective family education, and the effect of COVID-19 on delirium. A family handout on delirium was created with a short presentation to provide more information. Additional handouts were created to disperse information on delirium in critical care and delirium in the hospital in general. Various occupational therapy interventions were created to assist occupational therapists in the management of delirium. Presentations were recorded for the rehabilitation team and interdisciplinary team to provide essential information about delirium and promote occupational therapy's role. The evidence from the systematic review was translated into clinical practice through the Capstone project. First, an extensive needs assessment was conducted to identify the need for delirium resources. Once on site, needs were further assessed, and the project was refined to better reflect the evidence and fit the desires of the site. An evidence-based flow diagram was created to improve the workflow with critically ill patients experiencing delirium. The diagram was modified based on clinician knowledge, workflow, stakeholder interviews, and the established early mobility protocol. Implementation of the flow diagram did not occur during the Capstone experience. However, the process of adding the flow diagram to clinician competency materials was initiated the final weeks of the affiliation. The diagram was assessed through observation of clinician practice patterns and additional stakeholder interviews. Implementation was found to be acceptable, appropriate, feasible, and sustainable. The facility outcomes were assessed through the measure of implementation. Acceptability was facilitated by the flow from one intervention to the next, which felt natural and logical to the stakeholders. The largest barrier to acceptability was identified as the progression of early mobility leading to sensory interventions. This barrier was addressed through a recorded presentation, which provided additional context. Appropriateness was facilitated by the multi-component intervention strategy to manage delirium. However, the largest barrier to appropriateness was the comfortability of occupational therapy clinicians in working outside of the established early mobility criteria. Feasibility was facilitated by physician order sets, including occupational therapy for all patients admitted to Grant Medical Center. A barrier to feasibility is the limitations in documentation of delirium and delirium interventions in the EPIC documentation system. Sustainability was facilitated by stakeholder buy-in and their expressed desire to add the flow diagram to new associate onboarding and competency materials. A barrier to maintained use is occupational therapists' willingness and motivation to incorporate the use of the flow diagram into daily practice patterns. Future recommendations include providing clinicians with CAM ICU training for increased utilization of the delirium screening tool. Additionally, clinicians should be encouraged to watch the recorded presentation on the flow diagram to increase consistency and facilitate understanding. Measures for success of the flow diagram include decreased detection of delirium in critical care, increased clinician competency, and increased documentation of delirium. This is the flow diagram for occupational therapy management of delirium in critical care. As you can see, the 7 key occupational therapy interventions identified in the literature are outlined on the diagram. These interventions include early mobility, sensory stimulation, positioning, cognitive retraining, upper extremity function, basic ADLs, and family and caregiver engagement. This diagram is intended to be used as a tool for occupational therapists to guide their clinical judgment for implementing interventions to manage delirium. Thank you for listening to my capstone poster presentation on occupational therapy's role in managing delirium for critically ill patients. I would like to say a special thank you to my advisor, committee members, site mentor, and everyone at The Ohio State University, Grant Medical Center, and the Ohio Health System who has assisted me throughout this capstone experience.